The so-called double mutant variant of COVID discovered in India is suspected of fueling the continent's current wave of infections. First detected in samples collected in the city of Nagpur in October, it's now circulating widely. It's also been found in at least 10 other countries, including the UK, Germany and Australia. Little is known about the variant, but there's currently no evidence it's more lethal than the original version of the virus. But experts believe its mutations make it more transmissible. They also fear it could be more resistant to vaccines.
If this is a variant which is highly transmissible, though not necessarily more fatal, it is likely to spread faster, particularly if it's a new variant and there's a phenomenon of immune escape among the population in which it is introduced.
Also known as B1617, the variant has undergone changes to its spike protein, the part of the virus which enters and attaches to human cells. It's been dubbed a double mutant because it has two different mutations. Limited genome sequencing indicates that the variant now accounts for more than 60% of cases in some parts of India. But experts say it's not likely to be the only reason infections have surged, with non-compliance with physical distancing, mask wearing and other public health measures also contributing to the increase.
Here in COVID surge slamming India, officials calling it a tsunami. The country recording nearly 1 million cases in just 3 days. Experts saying that's just a fraction of the real number of infections. The healthcare system on the brink there. Train cars being used for patients. So many dead. Mass cremations are happening in the streets. Tonight, the haunting images and the warning for the rest of the world. Here's ABC's Julia McFarlane.
Tonight, what officials in India call a tsunami of coronavirus cases is fast becoming a global catastrophe. For the third day in a row, the country shattering world records. More than 345,000 cases reported in the last 24 hours. Nearly 1 million in the last 3 days alone.
The situation in India is a devastating reminder of what this virus can do.
The death toll so high, mass cremations are being held in the street. The country's underfunded healthcare system on the brink of collapse. Hospitals running out of room, leaving patients on gurneys in the streets. The government forced to turn these train cars into mobile units. This desperate young woman crying out, "This hospital is useless." Her mother taken away on a rusty gurney. Stricken hospitals pleading with the federal government to provide emergency supplies of oxygen after 20 people reportedly died without it in Delhi. The health ministry reported more than 2,600 deaths in the past 24 hours, but experts say even those figures are likely an undercount.
With every new infection lies the risk of another variant of the disease. This is not just India's problem, it's all of ours. Whit.
And that is a major concern. Julia.
आज बहुत बुरा हाल है। परसों रात को हमने यहाँ पे 78 बॉडी का क्रिमेशन। 5 साल का बच्चा भी आ रहा है, 15 साल का बच्चा भी आ रहा है, 20 साल के बच्चियाँ भी आ रही हैं और न्यूली वेड्स बच्चे भी आ रही हैं। बड़ा जुल्म आज देखा नहीं जा रहा है। इस समय जो हो रहा है हमारे यहाँ दिल भर जाता है देख के कि बच्चों को छोटे छोटे बच्चे मर रहे हैं कोरोना के अंदर, छोटे छोटे बच्चे मर रहे हैं। किसी शमशान घाट में जलाने की जगह नहीं है। बहुत बुरा वक्त है जी, बहुत बुरा वक्त है जी।
किसी ने हेल्प की नहीं एंड टाइम पे, वेंटिलेटर के लिए भागते रहे यहाँ से वहाँ। उसके बाद ऑक्सीजन ख़त्म होने की वजह से
are talking of this as the most alarming rise in coronavirus cases in any country at any point during this pandemic. As recently as March, as we heard, the Indian Health Minister was talking about that COVID endgame. But the number of new cases has risen dramatically since then, from around 10,000 a day to around 300,000 a day. Of course, the number of deaths takes a couple of weeks to catch up, but we're already seeing more than 2,000 deaths a day. And those who've analysed the number of daily cremations taking place suggest the number is many times higher.
From 4 a.m, India will be put on the red list, so most people who have travelled from there will be refused entry to the UK. For those here who call it their motherland, India's crisis is theirs too.